Hi everyone, and thank you for joining us for the Lamaze International Parent Webinar, Positive Pregnancy Test, the Top 5 Things You Should Do Next, presented by Jessica Deeb and Catherine Conrad. All right, Jessica, do you want to go ahead and begin?
Sure. Yeah,
Okay.
I'll start.
Okay.
My name's Jessica Deeb. I'm a nurse. I've been a nurse for about 10 years. Currently, I work at NYU Langone Medical Center as a clinical nurse specialist. We're a large academic medical center, and we do just under 5,000 births a year. I've also been a Lamaze certified childbirth educator for 2 years now. And currently, I am a mom to an active 2-year-old, and she's going to be a big sister hopefully in a couple weeks. As I'm 37 weeks pregnant with a surprise baby. So, well, Jessica, this is Serna. I'm working with Lamaze International, and while we work out those technical issues, I thought we'd just go ahead and jump into the conversation. Early pregnancy is such an exciting time for everybody. There's that moment of revelation. It's such a huge moment when you realize that you're expecting, and it sounds like you recently experienced that too. Can you talk a little bit about what some of the moms on the line tonight might have be going through or just recently gone through in terms of some of the physical changes associated with early pregnancy? Sure. I think waiting for that missed period can feel like an eternity. Sometimes it's that longest 14 days of your life. And maybe you tested early, days and days before your missed period. Maybe you tested often. You didn't believe that positive pregnancy test. So 3 tests later, you finally decided it was true. Or maybe you waited until it was undeniable. Perhaps you were tired of getting a negative pregnancy test, or you weren't quite sure that this is what you wanted, so you waited until the inevitable. But even before that, that double line, a lot of women feel like their breasts are getting larger and more tender. Some women feel a morning sickness very early on, or develop a fatigue, this exhaustion that just won't go away with sleep or rest, or maybe you're finding yourself more emotional. And I also commonly hear people feel like they're short of breath, and they're often surprised at this early in pregnancy. But these are all hormonally related. And as annoying or overwhelming as these symptoms can feel, it actually shows that your body has an adequate amount of hormones and that you're growing a healthy pregnancy. I'm going to keep going, so stop me if Catherine's able to join in.
Oh, I'm so sorry. I was on mute there. I think I just right past the poll that we wanted to do. We'd love to have a sense of who's with us tonight. So I think we're going to go ahead and put up that poll question. Tell us who you are and where you fit into these different categories. We'll give everybody a few seconds to respond, and then Sarah will read our results. Welcome, Catherine, and I'm going to step out and let you carry the rest of the conversation. If you want to take a second and introduce yourself to the group as well, that would be great.
Yep. My name is Catherine Conrad. I've been a Lamaze certified childbirth educator since 2006. I love teaching childbirth classes and have enjoyed doing that while I teach nursing education as my quote-unquote day job. I have one little boy. His name is Jack, and he is kind of the joy of our lives. My husband and I do love playing with Jack, and we also work to support birth advocacy in our area here in Oklahoma. So anyway, how many people were able to respond to our poll? How many people said they were just a few weeks along into the first trimester, in the second or third trimester, not pregnant yet, but doesn't hurt to plan?
So we have 50% of our attendees are in their first trimester, 17% are in their second or third trimester, but just want to see what they missed in their first trimester, and then we have 33% who are not pregnant yet, but hey, it doesn't hurt to plan.
That's great. That's wonderful. So it's nice to know that those are guys in your first trimester, welcome. Those are guys in your second and third trimester, welcome as well. We're so excited that you're coming and learning everything. It's never too late to learn. And of course, those of you guys that are thinking about planning and thinking about being pregnant sometime soon, welcome as well. We're so excited to have you all. So Jessica, now, you know, there's a lot that's on women's minds when they learn that they're pregnant. How do women decide what's important to focus on now? There's so much that are just kind of going through our minds early in pregnancy.
Yeah, I think it's really natural to focus on a lot of the external things and life-changing things initially. How am I going to tell my boss? What does it mean for my future work situation? Am I going to surprise my family and friends when I tell them? What is the nursery going to look like? But it's important to know that even though the 9 months until you deliver feels like a long way away, there's actually things that you can do now that set you up for the safest, healthiest birth possible. And planning ahead is really going to help you tackle those important questions. There's a lot of questions and unknowns that surround childbirth. Like some people might be wondering, why are so many women having cesarean sections? Will I need to be induced after my due date? Do I really need to get an epidural to manage the pain of labor? And taking a few smart steps during pregnancy can help to alleviate fears and get rid of the mystery that surrounds your baby's big day.
That's awesome. There's so much to go into, so let's go ahead and get started then. Now, the first tip is to shop around for a healthcare provider. Jessica, most often what I see is that women continue into the pregnancy and childbirth care, and they use the same provider they've used for all their well women exams and their pap smears because they figure, well, if they've been good for my well women exams and my pap smears, I should use the same person, right? But why is shopping around then for a healthcare provider for your pregnancy and birth so important if you already have somebody somewhat established, or even if you don't?
Yeah, that's definitely a big question that women ask, and I think it's important to know that physicians, midwives that serve you well for your well women needs might not be the same ones who serve you for your pregnancy needs, and it's not always easy to tell if they're going to match up to your birth preferences when you've only been seeing them for well woman needs or concerns along the way. And so we really encourage women to interview different care providers. Don't be afraid to shop around. You and your baby are the most important thing, and you come first. And by taking an active role in finding the right provider, you make sure that you and your baby's needs are met. You definitely need to challenge your own preconceived ideas. What about where you're going to give birth? The hospital is the most obvious setting, but you can also give birth at a birth setting or even home. And there's different kinds of care providers. There's your obstetrician gynecologist. Family physicians also have delivering privileges, and midwives as well. And they offer different types of care. So you want to research what is the type of care that they offer, what about the quality, the safety of the care they offer, and does this match up with your own personal preferences? And also, if your feelings about care that you want shifts over the course of the pregnancy, you'll have an idea if you want to switch the care that you are receiving. And this kind of brings to the most important point, is that while it might be a bit of a logistical challenge to change your providers during pregnancy, you can actually do it up until you go into labor, because you want to be confident that your provider will partner with you to help you have the safest, healthiest birth. And kind of a simple analogy is that you wouldn't go to one dealership to buy a car. A lot of people shop around. They visit different dealerships. They try to find who's the best fit for them, who has the best plan for them. And so you shouldn't feel pressured to stay with the provider that you currently have. And definitely chat with friends, other moms, learn about their experience with different providers and birth settings. Why did they like that provider? Did they have any concerns? What about the hospital setting? Were there things that happened there that felt just routine, or did they have a really positive birth experience? And I like to point out that Lamaze.org has a really good overview on choosing a health provider for you. And at the end of the post, there's additional resources and links to helping you formulate questions in terms of how you know that that provider is the right one for you. And I think one of the most important questions to ask your provider is, what is the philosophy, what is your philosophy of birth? You should hopefully be hearing things like normal, or we expect a healthy mom and baby. These are signs of a good provider.
That's great. That totally makes a lot of sense. But it's not always easy to find the right provider for you as an individual and for your individual family. What are some things that might hold women back from taking the super savvy shopper approach?
Yeah, definitely these things that are up on the screen right now, not knowing what's out there. You've been seeing the same doctor forever. I don't want to offend my provider. That's a really big concern that we hear. I've already started seeing someone. Can I really switch mid-pregnancy? And why would I switch providers? And again, I think it's important to know that you can shop around, and I can speak personally from experience that I was confused the first time that I got pregnant, so I actually started care with somebody that I knew out of town. That gave me a little bit more opportunity to shop around, see what was out there. I was interested in midwifery care, low-risk care, and so I thought I found a midwife that I really wanted, and I went on the tour of the hospital, and I realized that was not a good match for me. While the midwife may have been good, the birth setting was not going to be good. And I ended up back with some doctors that I work with because I felt like they could really give me the low-risk care that I wanted in that optimal birth setting. And here in my second pregnancy, I had to make a decision again. I ended up having a C-section the first time around, and not wanting to have a C-section again, I felt like I really needed to choose the right providers. So I went back and looked over statistics of hospitals in the New York City area who had the best VBAC rate, vaginal birth after cesarean, what was their overall cesarean section rate. And I had conversations with the doctors in the group that I had been with before, and they really talked to me about wanting me to feel comfortable with the care that I was receiving. And so I chose my providers again rather than defaulting back to them. And so I think it's good to know that women who are very ingrained and knowledgeable about childbirth education have questions too, and they need the support from their providers as well. So you're not out there on your own wondering if the provider is the right one for you. But again, we want you to choose your provider rather than just stick with somebody because that's the way it's always been.
That's great. Well, if you're not in the childbirth field, should you call and say, I'd like to schedule an interview? Do I ask for a consult? What's kind of the wordage in your area? Because I know here in this part of the country, in the middle part of the country, some people say, oh, you can schedule an interview, or I'll do a consult, or the practice, certain practices will have meet and greets. How do you actually call and say, I need to get some more information and actually talk to the provider and not just to the front desk?
Yeah, and I think that every provider is a little different in the way that they set up their initial visit with people. I find midwives do a lot of meet and greets. That usually is a free consultation in terms of interviewing a provider. I'm sure there are some that charge for that initial consult, and the front desk of who you call can often give you information about how their practices do it differently. I find in the New York City area, people switch providers a lot. Hopefully they're making their decision before they're pregnant whenever they can, but that often isn't the case. And so they ask around word of mouth, hey, who are you seeing? Are you happy with your prenatal care? And that kind of gives them a little bit of an in into a doctor's office. But, it's really about kind of doing those cold calls to the doctor's office and asking them how they arrange it and set up for those meet and greets.
That's a great idea. Call the office ahead of time, especially if you're talking about a potential charge, because it's a good idea to know what you're getting into before you walk in, that's for sure.
Mm-hmm.
Real quick, we have one other quick question for our poll today. Telling the world you're pregnant is a really exciting time. Tell us if you're out with your pregnancy yet. Is it just you that knows so far, just you and your partner? Is it only your family and closest friends, or does everybody know so far?
Okay, so it looks like we have 17% is just myself and dad or partner, and then 50% of participants say only my family and closest friends, and then 33% say everyone knows.
Oh, that's awesome. So, and that's especially important to talk about as we start getting into holiday times, because really one of the first things that's going to come up is, one of the first questions people are going to ask you is, great, congratulations, you're pregnant. When's your due date? And I think that's one of the biggest things that people have to navigate around. From the time you learn that you're pregnant, somebody's always saying, when is the baby coming? Do you know the exact date? What's going on? So, Jessica, how do you feel like women can avoid getting tripped up in those high expectations that are centered around the due date?
Yeah, there's a word that's often missed from the beginning of due date, and that's estimated. A lot of people forget that that's the actual term is estimated due date. And it would just be crazy to think that we could predict one exact day that the baby is most likely to be born. Most babies are not born on their due date. It's about a 2-week window before or after. There was a recent study that came out that said the normal gestational length for women varies by about 5 weeks. So you know, it's hard not to plan for a specific day, but remembering again that it really is an estimated due date, or I've heard people call it a guess date. Babies don't have calendars, right? Every pregnancy varies. But we do want to give you some tips so that you don't get tripped up by that due date. And it's good to know when your last menstrual period was. A lot of people use the abbreviation LMP. You'll see it up on the screen there. That does mean last menstrual period. So remember when that last menstrual period is, and it might be hard to recall for some women, but kind of having a good sense of when it is. When I've worked in the offices before, I say, hey, you know, was it around a holiday? Do you remember maybe you went away for the week? Because what that's going to do is give us clues to capture the best date. But then you also need to think about the average length of your cycle. Due dates are based off of a 28-day cycle. So if your cycle is longer or shorter, that actually can affect the calculation of your due date. A lot of providers now are doing early ultrasounds to confirm that due date, which could be, or usually is a good thing in terms of confirming, yes, the last menstrual period does give us a good due date, or, hey, you're one of those women that has a long cycle. Maybe every 35 days you get your menstrual period. We're going to push your due date back by a week or so. And the way that we confirm the due date with the ultrasound is that if it's greater than 7 days, the discrepancy between the ultrasound and the last menstrual period due date in the first trimester, they'll change it to the ultrasound. In the second trimester, ultrasound takes preference if the discrepancy is greater than 10 days, but that's only up until 20 weeks. After 20 weeks, there's a large discrepancy in terms of the accuracy of ultrasound in calculating gestational age. So really, due dates should be assigned in the first trimester. If you've had a first trimester ultrasound, that's the one that should be used. You shouldn't be reassigning a due date with a follow-up ultrasound in the second trimester, and really extreme caution should be used in reassigning a due date after 20 weeks of pregnancy. But sometimes we do hear care providers say, oh, your baby is growing big. We're going to move your due date up by a week. But what ends up happening is that your baby is not mature. They might be size-wise right, but the lungs and the brain still have more time that they need to develop. And they might also cause you to have an unnecessary induction if they move your due date up after that 20-week mark. ACOG recently changed their definition of full term. People used to say full term was 37 weeks and beyond. ACOG is really sticking to 39, 40 weeks as a full term pregnancy. And so hopefully that'll help people feel like their baby's not coming late if they go past that 37, 38 week due date. And again, ultimately your baby decides when he or she is ready. They're the ones that are going to set off that hormonal cascade that's going to send you into labor. And again, the safest, healthiest thing that you can do is to let labor begin on its own. And unless you or your baby are facing a medical emergency or condition, if somebody's pressuring you to give birth just because it's your due date, maybe it's your provider, maybe it's your family or friends, push back on them. Ask them why it's so important that you deliver, and make sure that they know that you want to let labor begin on its own as your baby chooses its due date.
That's so important for the baby to come when the baby is ready. You know, and all of those things do kind of lead into other things. You know, often, you know, we get into, once we start talking about an induction, we start getting into other type of challenges. So what other challenges are we talking about once we start talking about a push towards an induction or a push towards other things? What are the other challenges that moms might face?
I think it's really important to remember that hospitals and physicians can sometimes replace best evidence-based practice with routine practices. And there's definitely a break down in the care that women receive and expect to receive, or what women expect and deserve to receive and what they actually do receive. And unfortunately, a lot of the practices that occur in obstetrics are tradition-based rather than evidence-based. And there's a lot of medically unnecessary interventions that don't provide a safe and healthy birth for your baby. Looking at some of those that are on the screen, I think it's important to know about epidurals, non-medically indicated C-sections, induced labor, electronic fetal monitoring, restricting movement during labor and pushing, restricting eating and drinking, not having adequate support, and routine separation of mom and baby. A good example of this is that a lot of hospitals, as soon as the baby's born, the baby gets brought over to a warmer so that the baby can be monitored to make sure that they're transitioning from birth to life. And in actuality, the evidence says that the best place for the baby to transition is on the mom's chest, skin to skin. And I'll tell you, when I first started in nursing, I couldn't imagine putting a baby skin to skin with their mom. That baby needed me to watch it and make sure that it transitioned. And over the course of years, I've learned that that's wrong. Babies need to be skin to skin with their mom. And so I think that's just a good example of how routine and tradition has kind of gotten in the way of evidence-based. But the more you know about childbirth challenges, the better you are to make decisions that are the best for you and for your baby. And I'm just going to go to the next slide and point out about Lamaze's 6 healthy birth practices. These are available on Lamaze's website, and I really think that they are key for the pregnant woman and her partner to know about before she gives birth. If you take a Lamaze class, these will definitely be the central portion of the class. And there is one, just kind of what we're talking about, called Avoiding Unnecessary Interventions. And there's a great article and a short video on it, and it really can help women educate themselves, because a lot of women don't actually know what the routine interventions are in labor.
This is so important. Do you know, are there a few questions or things that parents can ask to make sure that they're receiving evidence-based care rather than routine care? What are some things that they should hear as clues towards evidence-based practice from their providers and from their hospital tour?
Yeah, I think that one of the things that I like to teach women to use words like ACOG, which stands for American College of Obstetrics and Gynecology, and evidence-based care. So if they're concerned about the care that they are getting, I think that using those words with your provider, what does ACOG say about that? So ACOG is the governing body of obstetricians who kind of sets the pace and the standards of the care that women should be given. And I think it's also important to use words like evidence-based. You're saying that you want to induce me because the baby is looking big. What does ACOG say about that? Because they have a stance on it, and your physician and midwife should be following what that stance is. So I think that, you know, knowing those words, ACOG, again, I'll say it and you can write it down, and evidence-based care are terms that you should be familiar with so that you can challenge your provider if you feel like the care you're getting isn't evidence-based. And I think, again, looking through those Lamaze 6 healthy care practices is important so that you know what you should be asking about. You know, I've heard that some women are given Pitocin or induced during labor. Is that something that you think is important or that you routinely do? If you're not familiar with these unnecessary interventions, you wouldn't know to ask that question.
Those are all incredibly important questions. There's so much information out there. But women need information to get the safest and healthiest possible birth for themselves and their babies. So what are some of the things that women can do and families can do to make sure that they get the safest birth and the best birth for them?
Yeah, I think our first recommendation is to sign up for a Lamaze class. Sign up for that childbirth education class. These classes go far beyond what your mother perhaps learned in her Lamaze class of breathing and pain management techniques. We talk about the current state of giving birth and labor, and it can help you identify your options, and you can learn what your preferences may be. And the more you learn, the more you know, the better understanding you'll have if your birth preferences match your providers. And also, I think one of the most important things of taking a class, beyond the information that you gain, is building that community, the community of other women and their families who are pregnant and going through the same thing as you, and also having a childbirth instructor who can help guide you in terms of connecting you with other healthcare providers if you need that, or prompting you on questions and conversations that you can have with your care provider. The other thing that we recommend is that you be wary of red flags that come up during your prenatal care. If people say things like, most women get epidurals, that might be a bit of a red flag, as opposed to saying things like, we encourage women to try non-medical alternatives before using an epidural to alleviate pain. It kind of changes pregnancy from being a medical model to a normal process. The other thing that Lamaze has on their website is you can sign up for a weekly pregnancy emails. We also have a blog called Giving Birth with Confidence. And there's also this official Lamaze guidebook, and I'll tell you, I read it during my first pregnancy, and I'm rereading it now because it has a lot of great information and, again, normalizes birth. So if you haven't checked it out, I encourage you to connect with the Lamaze website. There's also other helpful resources like Childbirth Connection, has a lot of evidence-based information on it, and March of Dimes is another great resource as well. So making sure that when you get online that you are going to solid websites and using advocacy-based information when you're doing your research.
Well, it's definitely important that we get our information from a variety of sources. We certainly want to get some information online from reputable sources such as Lamaze, but we do want to go ahead and make sure that we're getting an in-person class, if at all possible, that you're meeting with a class on a regular basis so that you have a community that's growing around you, just as Jessica says. And it's certainly important that you seek out a Lamaze certified childbirth educator. I know in my neck of the woods, occasionally I'll have people say, oh, I took a Lamaze class, and I'll go, well, great, who did you take the class with? And they'll say, oh, I took it at this place. Well, that's great. That was a childbirth class, but it wasn't necessarily a Lamaze class. And there is a difference with people who are certified and people who are teaching a class out of other knowledge. So you do want to seek someone out who is certified. One of the big pieces to a childbirth class is bringing your partner with you as well. The partner is the person who's going to come with you when you have your baby. That could be your husband, your boyfriend, your significant other, your mom, your sister, whoever's going to be with you when you have your baby. And I know having a partner who's there, who's knowledgeable about pregnancy, labor, and birth, as well as understanding the challenges you may face, will really make a big difference when your baby's big day comes, and making that big day dramatically easier for you. So it can be really difficult, though, when you're going through labor pains and you're excited. How do you advocate for your preferences? Do you want an epidural? Do you not want an epidural? Having a partner who's aware of your choices and who can be there for you and add the extra layer of support and comfort makes a huge, huge difference for moms. Jessica, how can our moms get their partners to offer the support that she needs?
Yeah, definitely. The partner has a big role in birth, and you might think that it's all about mom on that birthday, but partners and dads, they're equally important, and because they're going to be her advocate. Like you said, if mom's in pain, if she's anxious, she can't make decisions for herself, that partner is there for that, in addition to offering continuous support for her. So we really want birth partners, dads, to get educated, to go to those Lamaze classes. I also teach a healthy pregnancy class in addition to a Lamaze based childbirth series, and you'll see men peek their head around the corner and say, is it okay if I'm here? Is this class for me too? And the answer is absolutely yes. We want you guys involved from the beginning. We want partners to be there the entire pregnancy. And so it's good that the partner has a solid base and understanding of pregnancy, labor, and birth. Obviously, they don't need to be a doctor, but taking childbirth education class is going to equip them with basic information, research, evidence that's going to guide the important medical decisions that they're going to make throughout the pregnancy and labor. Getting educated also helps you understand your role and your expectations. It's important that your partner knows that they are going to be a big part of the birthday, and your partner probably knows you better than anyone else, and so they can help interpret those subtle signals of, you know, this is the way she acts when she's really in a lot of pain, or she's confused, or she's anxious, and they can relay the meanings of your cues to the birth team. Partners, they should be with you to map out labor support, having an honest conversation about how your partner is going to support you in that role of being your support person in labor, and perhaps having a conversation too about should you hire a professional person to support you in the labor process, and that would be considered a doula. And a lot of people don't know about doulas, and childbirth education classes are a great way to find out more about the doula.
Well, what do you say to partners who aren't comfortable with having a doula, who aren't really sure, you know, gosh, do we really need this additional person?
Mm-hmm. Yeah, that's really common. I often hear women say that their birth partner is their doula, or that their partner might feel pushed out of the delivery. And I think it's important for people to know that the doula is really there to support the couple, and getting the partner dad involved in the birth process as much as they're both comfortable in that. But they're trained. They know comfort measures. They can encourage dad to, you know, maybe massage mom's back or offer different birthing positions for the woman. And DONA, they're the organization that certifies doulas. They actually address this question in their frequently asked questions about what happens if my partner feels pushed out. So doulas are aware that dad's birth partners are part of the team and aren't looking to push that relationship aside, but rather support it.
That's great. A doula is a really important role that can help both the mom and the dad and the birth partner have a great experience and get more out of the experience of having a baby. That's for sure. And that, while that's a big piece, you know, preparing for the birth itself is a big piece of getting ready for birth and getting ready, getting educated during pregnancy. But what can moms do to really start taking care of themselves? Obviously, they need to take care of themselves. They want to make sure that their baby themselves there and their baby is as healthy as possible. But what are some tips that we can do? What are we supposed to do for moms that have already heard about this?
Yeah, I think that it's not uncommon for women to be labeled as high risk during their pregnancy. And sometimes high risk can seem fun because you get extra monitoring, you go for ultrasounds, you get to see your baby more during the pregnancy. But being labeled high risk is a serious matter. Some women need extra help controlling their blood pressure or their weight during pregnancy, so taking care of those issues ahead of time is always the best. But even if you weren't able to manage your health problems before you got pregnant, you can still do that during pregnancy. And knowing, though, that being labeled high risk can expose you to additional interventions that actually can make your delivery more complicated. And this is true even if your risk actually doesn't lead to a complication. Some women are labeled high risk just because they're over the age of 35. So maybe their pregnancy has been entirely normal, but suddenly that risk becomes a complication and the doctor is looking to intervene at the end of pregnancy. I also think it's important to consider the testing that's done during pregnancy, and knowing that most testing that is done is a screening test. So that means that you're going to get answers that perhaps you need to follow up on if you don't get a negative screening. And those ambiguous results can follow you throughout pregnancy and impact you towards the end. So I think knowing your medical conditions, knowing your age, knowing your risks during pregnancy, but then really truly translating it to, is this going to complicate my pregnancy? Do I need more interventions? Being educated on that level is extremely important.
Definitely, because the label high risk can be a very serious thing, but sometimes don't we see providers overusing the term high risk as well?
Yeah, absolutely. Just as I mentioned, age before can be considered high risk. Being overweight itself can be high risk for some doctors, but again, that risk doesn't always lead to a complication. In fact, most women who are overweight during pregnancy have a normal, healthy pregnancy. And so you want to make sure that, again, that high risk doesn't follow you throughout pregnancy and influence the way you're going to deliver if there's no complications that are associated with it. I think that, again, getting on the Giving Birth with Confidence blog and the Childbirth Connection website is going to give you the evidence and quality information that you need to know if you're truly at a higher risk, or, you know, perhaps it's just a label that you've been given.
Well, what can we do to make sure that moms have a happy and healthy pregnancy? What are some tips for them?
Yeah, some simple lists, just like we have up here on the webinar, is eating a well-balanced diet, avoiding dangerous substances, staying active, getting plenty of rest, definitely taking time to enjoy the growing bond between you and your baby, minimizing stress, thinking about your labor and birth preferences, but again, enjoying pregnancy. And if you look at that list, it's not actually very different than what you should be doing in everyday life to be maintaining a healthy lifestyle.
Yeah, these are all definitely important things at any point in your lifespan, that's for sure. What are some things that we can learn about in a Lamaze class that will help us not only have a happy and healthy pregnancy, but also help us to kind of navigate all these hot topics that occur within pregnancy and birth?
Yeah, I think it's important to sign up for Lamaze classes early, or get connected with a Lamaze childbirth educator early, because a lot of them offer early healthy pregnancy classes, which bring up a lot of these topics that are listed here. You know, every mom wants to know what's going to be best for her and her baby, and there are lots of controversial topics out there in terms of what's best for mom and baby, and the Lamaze Certified Childbirth Educator is really going to help you get the evidence that you need to know about rules that you can break, or which rules you should follow. So these are some hot topics that women come up with, and you know, many of these are addressed in that Lamaze class, or maybe a healthy pregnancy class taught by the childbirth educator.
That's great. Jessica, what do you think are your hot button issues? Where do you think the biggest misunderstandings and knowledge gaps are?
Well, I don't know if it's the biggest one, but my favorite is caffeine. Being a coffee junkie, I always get very sad when women tell me that they gave up coffee or caffeine during their pregnancy, because that's one of the things that is a myth out there, that you need to give up caffeine during pregnancy. You know, there's about a 200 milligram to 300 milligram recommendation that you take in each day, which equals, if you're brewing your coffee at home, 2 to 3 cups of coffee a day. And so that, for me, is a personal favorite. Pregnancy weight gain is a definite hot topic of women having questions about it. Maybe they've heard that they shouldn't gain a lot of weight, or that they need to gain a lot of weight. They're eating for 2, and you know, the general recommendation is that women gain 25 to 35 pounds during pregnancy if they're of a normal weight. You know, your doctor may adjust that number a little bit based on if you started pregnancy at a lower weight, or perhaps if you were overweight. But really, you know, eating a healthy, balanced diet and maintaining exercise throughout pregnancy are going to help you gain the ideal weight. And then, of course, food safety is always a question on women's mind. You know, people might say, oh, I've heard that it's not true that you don't, that's too many double negatives. People say, I heard it's okay to eat deli meat during pregnancy. And the answer is that no, it's not safe to eat deli meat during pregnancy unless you heat it till it's steaming hot. Deli meat today still carries the same risk that it did a while ago in terms of bacterial contamination that can make both mom and baby really sick during pregnancy. So that's something, too, that we clear up in childbirth classes, is kind of the myths and the truths about food safety, again, caffeine, pregnancy weight gain, and some of those other topics that are listed on the slide.
This is great information, Jessica. Let's go ahead and take a few questions from our audience before we go ahead and wrap up for the day. You can go ahead and type in questions on the bottom of your panel, of the GoToWebinar panel, and Sarah will let Jessica know what those questions are. Well, Jessica, I have a quick question that I think people really need to be aware of. Where's the best place for people to find a Lamaze certified childbirth educator? Where are they going to go and find a list of those people?
Yeah, lamaze.org, right? Lamaze.org. There's a search engine on there that you can find Lamaze certified childbirth educators in your area, and it gives you, the phone numbers, websites to contact them. And just like Catherine said before, finding Lamaze childbirth educators are really important. Lamaze certified educators have taken a test to say that they have knowledge to teach childbirth education classes. We also make a commitment to teach our classes a certain length of time. Usually that's 10 to 12 hours in a series. You shouldn't be taking a class for 3 hours and think that you have all the information that you need to go into labor and delivery. So again, going to that lamaze.org website and finding that certified childbirth educator is really important to your labor and delivery experience.
You're right, that is so important. And that's such an easy tool for people to use, for sure. Sarah, did we have anything come up on the screen?
Yeah, we have a few questions. So the first question is, I've never considered using a midwife. Why do women choose to use a midwife, and what do they offer that an OB doesn't?
I'd say that the biggest difference between a midwife and a medical professional is going back to the philosophy of birth, that midwives tend to view pregnancy more as a normal process, a part of a woman's life, where often physicians in their medical training are taught that pregnancy is another illness or a diagnosis that needs to be managed. And not to say that every midwife and every physician holds that true, but a lot of people think midwives are just for the woman who wants to give birth at home or does not want any pain medications, and that's not true. They're also there to support you in the choices that you make, but again, always viewing it from a normal process. So I think that midwives are definitely something to consider if you know that you're a low-risk pregnancy or that you want to be viewed as a normal process in your life.
Okay, great. Thank you for that answer. We have another question about electronics and pregnancy. So is it true that pregnant women should keep electronics such as cell phones, computers, away from their belly area? I know this is kind of a specific question, but if you have any experience on that, could you enlighten us?
I don't think that there's any hard, fast research that says that using your cell phone, keeping it near your belly, is going to cause any problems. I guess the other end of that is that we've only been using cell phones and electronics to the extent that we're using it for a short period of time, so perhaps the research hasn't shown it. I think, if you're using your cell phone in moderation, that you're going to be fine. Your baby's going to be fine. So I wouldn't get caught up in knowing how much screen time your belly has had at this point.
And then can you talk a little bit more about avoiding deli meats, and does that include places such as restaurants or sub shops that sell deli meat? Should those be
Yeah, absolutely. It's deli meat anywhere. You know, so some restaurants do, like, they'll say roast a turkey or chicken, and they slice that. That's different. We're talking about deli meat that's been packaged at the manufacturer, so even like, you know, boar's head or wherever else has the risk of being contaminated with listeria. And so what you need to do is to kill that bacteria, and the way that you do that is heating it steaming hot. But that's kind of the general rule of thumb for all food safety during pregnancy, is that you want to avoid the food contaminants. So, you know, rare hamburgers, raw seafood, those are the high contaminated foods, and the way, again, that you combat that is you heat them until they're steaming hot, and that's what's going to kill the bacteria. So whenever in doubt, definitely heat up your meat, your deli meat. The one thing I will say that another personal favorite of mine is soft cheeses. That soft cheeses are actually safe during pregnancy because most sold in the United States are pasteurized, and those do not have the risk of contamination. So again, almost all soft cheeses are pasteurized in the United States, and if you're unsure if it's pasteurized or not, the way you're going to get around it is you're going to heat it up. So just remembering eating your food steaming hot is going to help kill that bacteria.
And then another question we have is, how do you decide if you can, quote unquote, handle a natural childbirth with no pain meds?
That's a good question. It's a tough question to answer too, because everybody's so different in terms of their pain tolerance, and just because you maybe had a tough experience with a broken arm doesn't mean that that's the same pain that you're going to experience during childbirth. I think that you might not know what you are able to tolerate during labor, and it probably depends on the length of your labor, and that's why you know, taking a class is really important, that you're able to learn tools in managing and handling the pain of labor, and so that when you are in labor, you can remember back on those comfort techniques and using them during the labor process. And I think that it would be unusual to find a Lamaze certified childbirth instructor who is anti-epidural to the fact that she will not talk about it during her class. We do believe that epidurals are a way of managing women's pain, and that when used appropriate, they are a good intervention. And so I think that learning as much as you can about managing pain comfort techniques during pregnancy, practicing them is going to give you a good sense of how your labor may play out.
Okay, wonderful. Another question is about a cesarean, and the question is, if I want to avoid a cesarean, what is the single most important thing I can do in the first trimester? And then also
in the first trimester?
Yes. Or then also
I would say that in the first trimester, the single most important thing you can do is choosing the right provider and birth setting. I know in New York State, and I'm sure other states as well, have their hospitals post their C-section rate online. And so that is like one of the first things I think that's great to do, is to look up your hospital and see what the C-section rate. Some hospitals' C-section rates are as high as 48%, and then there's some that are as low as less than 20%. And so choosing that right hospital setting, I think, is the first aspect of it, and then asking your provider what their cesarean section rate is. And they shouldn't be offended by that question. They should know the actual answer. If somebody says, oh, I'm sure it's pretty low, they might be skirting around the issue, because that's something that hospitals track. And doctors probably track that number as well. So again, asking those questions, what's the C-section rate of the hospital and your provider. And again, that kind of goes back to my own story of choosing the hospital again that I delivered at because they had one of the best VBAC rates in the city and also one of the lowest C-section rates. And I felt like that gave me the best opportunity to avoid a second C-section.
Okay, great, thank you. And then we have another question about sleeping positions. Is sleeping on your back and right side unsafe?
Do you mind repeating? You were a little soft in your question.
Sorry about that. This question is about sleeping positions. Is sleeping on your back and right side unsafe?
Oh, yeah. That's another question that people ask a lot. There's so much misinformation about that. In theory, sleeping on your left side is the best position for you because it, again, in theory, provides the best blood flow to your baby. However, sleeping on your left side for 9 months is a little bit unrealistic. And there's not been a study that says sleeping on your right side is harmful to the baby. The other thing is that what happens is when your body decreases blood flow to the baby, so say you're laying on your back in your latent pregnancy, the uterus is pushing on some of those blood vessels that provide the blood to the baby. Mom doesn't feel well. She becomes lightheaded. She becomes nauseous. And that's one of the first signs that something's going on in terms of your blood flow, and your body says, hey, wait a second, this doesn't feel good. I'm going to turn on my side without you even saying that. And so I encourage women not to get caught up in sleeping positions. Sleep on your right side, sleep on your left side. If you wake up and find that you are on your back, your baby is okay, and probably the reason that you woke up is maybe your body saying, wait a second, this doesn't feel good. We need to turn. So it's not unsafe to sleep in those positions that you described.
Okay, thank you so much for that insight. And then another question is about how sugar affects the body. So this person says that they have reduced their sugar intake during pregnancy, and it's quite difficult, and they want to know if you have any insight onto how sugar affects the body while pregnant.
Yes, sugar affects the body in a lot of different ways, and it is difficult to reduce the amount of sugar in your diet. The baby, the diet that you have now can set your baby up for long-term chronic diseases. So maintaining a healthy diet can prevent chronic heart disease in your baby, type 2 diabetes. There's been some correlation between a healthy pregnancy and those chronic diseases. I don't think anybody would go for total elimination of sugar, but again, thinking about what is the best fuel that I can give my baby? Is it cookies for a snack, or is it an apple with peanut butter? What is going to give the best nutrition for the baby? And I think a lot of women find that helpful in terms of reframing why they're eating their foods that they're eating. So does that mean no ice cream after dinner? Absolutely not. Everything's fine in moderation. But there is definite health benefits to the baby and to mom, because not gaining too much weight during her pregnancy helps with postpartum weight loss and long-term chronic diseases for her. Women who carry extra weight later in life are more at risk for type 2 diabetes. So I think that the big thing to remember is moderation. It's great that you're able to cut out some sugar, and just kind of thinking again back to when you're making food choices, what is the best food choice that I can make that's going to support a healthy pregnancy and give my baby the best nutrition that it needs.
Okay, thank you. And we've had a couple of questions on multivitamins or prenatal vitamins, and do you have any recommendations for prenatal vitamins? Also, is DHA important?
Is DHA what? Important?
Important, yeah.
I think that the best thing to know about, brand is not important in terms of a multivitamin. So if you want to buy an over-the-counter prenatal multivitamin, that is just as good as the $70 a month prescription. So I wouldn't get caught up in brand at all. The other thing that's important to know about multivitamins is that these are not replacements for a good diet. You know, if you are eating a well-balanced diet, technically you shouldn't even need a multivitamin. And DHA is the same thing, is that DHA is important during pregnancy, but the best source of it is in your food. So eating fish during pregnancy is important for the baby's brain development and is going to get you better results than taking a supplement daily. I know personally, this pregnancy, I haven't been able to tolerate prenatal vitamins at all. And so I asked my doctor, I said, well, do you think maybe I should be taking like a Flintstones or a child's vitamin instead? And she said, that's for people who don't have a good diet at all, that they're really starved of their nutrients. So again, remembering that you should really be getting your nutrients, your minerals, your vitamins from your food sources whenever possible, and thinking about the multivitamin as being more of a supplement than that magic pill.
Great, thank you. We have 4 more questions, and I just want to get through these last 4, and then if that's all right with everyone, and then we're going to end the webinar just in respect for our presenters' time. But our next question is, are there any homeopathic remedies to deal with a constant headache in early pregnancy? So ibuprofen and Advil, they're just not doing it for this person.
Yeah, actually, ibuprofen and Advil should be avoided during pregnancy. Tylenol is, generally speaking, safe. However, if you're using it more than a couple times a month, I would talk to your provider about that. Some women find, if they've eliminated caffeine, if they're heavy caffeine drinkers, before pregnancy, and maybe they cut way back or they cut out entirely, that when you do get a headache, drinking a small cup of a caffeinated beverage can help alleviate that. But beyond that, I think it's really a conversation that you need to have with your physician or midwife and see if they can help with some alternative pain relief options. Obviously, heat or cold is safe to use on a headache, but they can kind of help you figure out the source of your headaches and offer solutions that are specific to that individual's needs.
Okay, great. Thanks for that. And then another question is, my provider is a midwife, and I was wondering what your thoughts are on having a doula as well.
Yeah, I think that if you are interested in having a doula, having a midwife does not rule that out, because it goes back to the same philosophy if you have a doctor, is that the midwife is almost always unable to care for you continuously. And there's really a strong correlation between continuous support and decreased cesarean section rate, decreased pain medication, increased satisfaction in birth. And somebody told me recently that there's been studies that if the doula takes 2 tea breaks during the woman's labor, that kind of her work has gone out the door, that she's really expected to be at the birthing woman's bedside, and that continuous support is vital for that laboring woman. So, your midwife, she might have to answer a phone call for another patient. She might have another patient in labor, and she's unable to provide that continuous support. And I think that you'd find that most midwives would advocate for you to have a doula and recognize the limitation of their ability to provide that continuous support.
Okay, just 2 more questions. How do you deal with the burning breast sensation in the last trimester of pregnancy? I don't know if this is too specific of a question. Yes, a burning breast sensation in the last trimester.
I would bring that up with your provider just to make sure that there's not something medically going on. I would make sure that you have an appropriate bra size. Breast size changes throughout pregnancy, first trimester, second trimester, third trimester, and making sure that you have a good supportive bra, and trying to maybe move away from using underwire bras. Nursing bras actually have a thick cotton support to them, so they don't use the underwire, so that might be something to consider as well. if cold feels good on them, that's fine to use as well. The nice thing about feeling breast changes during pregnancy is it's a good reassurance that your body is going to be able to make milk because it's responding to the hormone changes. So again, finding a good supportive bra, knowing that you're going to have to change bras throughout pregnancy. And again, I would bring that concern up with your provider so that they can offer a little more specific direction.
Okay, and just one last final question. What are some of the telling questions that I could ask of my care provider to see if they're going to see my pregnancy as quote-unquote normal or as a complication that needs to be managed?
Yeah, I think that one of the best questions that you can ask is, what is your philosophy on birth? Hopefully hearing those words like this is a normal part of a woman's life. If you're hearing things like, well, we run a lot of tests to make sure that everything's okay, that would be a clue that perhaps your provider does not recognize birth as normal. And kind of getting into some of their statistics, like how often do you find that you need to intervene during labor? How many of your patients are induced? How many of your patients have cesarean sections? Getting a handle on their level of intervention, because the higher level of intervention that a provider reports, the less likely they are to view birth as normal. I think it's important to ask about their episiotomy rate. Episiotomy rates really should be less than 5% of their vaginal deliveries. And if they're telling you that, 25 to 50% of their women need episiotomies, that would be a red flag for me. So again, kind of asking those nitty-gritty questions and seeing what their answers are in terms of cluing you into normal birth versus an intervention-based birth.
Okay, thank you so much for taking the time to answer our questions, Jessica. Now I'm going to turn it over to you and Catherine for any final closing remarks.
Well, Jessica, thank you so much for providing such great information for all of our families that are joining us tonight. I think you've brought up some really great points, and definitely a good place for moms to start is with the Lamaze website as kind of their go-to place for information. There's lots of information listed on there. So, and congratulations on the upcoming birth of your new little one, Jessica, as well.
Thank you.
Thank you all for joining us today. We appreciate your time, and we appreciate your effort in listening to all this information here and asking some really fabulous questions. We really appreciate the time that you've spent with us today, and we hope that you all have a safe, healthy, and happy birth.
Thank you, everyone. I just want to follow up with one final point. If you have any additional questions, feel free to email education@lamaze.org. Thank you, and have a great night.